Good day, the audience. My name is Habib from Faculty of Medicine Universitas Indonesia. It is my pleasure to have the good opportunity to present our research entitled Understanding of Sexually Transmitted Infections Among Reproductive Age Women in an Urban Community Health Center, a cross-sectional study, in this wonderful AOGIN event 2021. Sexually transmitted infections, or STIs, are common among reproductive age population in developing countries, including Indonesia, and women are more at risk to develop STIs for several reasons. One of the factors contributing to STIs' high incidence in the community is insufficient knowledge, attitude, and STI prevention behavior. Therefore, through this study, we aim to understand the association between STIs-related knowledge, attitudes, and behaviors among female reproductive age patients. Also, we aim to know the demographic profile of the female patients of reproductive age in the Makassar district, East Jakarta. This is an analytical cross-sectional study with 50 samples of reproductive age female patients who visited all polyclinics in Makassar District Health Center, East Jakarta, for 1 week in July 2019. Our result showed most patients, about 70%, are in the productive age group, which is 20 until 29 years old, with married status, 74%, high level of education, 88%, and mostly patients have children, it is about 74%. Knowledge of STIs were related to the patient attitudes. The p-value below 0.05. Knowledge of STIs was good in 84% of subjects and a positive attitude in 88% of patients. This study didn't find relationship between knowledge and attitudes towards behavior using condoms, behavior suggesting condom to her friend, abstinence behavior, as well as the behavior avoiding people with HIV. In this study, only 32% of the subjects showed condom use behavior, and only 1 people would suggest using condom to her friend. Our result is consistent with previous study in youth urban population in Nigeria in 2019. The high level of knowledge and positive attitudes among women in the study can be caused by the large number of subjects with a sufficient education level in line with demographic of urban area. Knowledge and attitude were related because someone who has extensive knowledge will tend to display positive attitude toward STI screening and visiting doctors for relevant symptoms, and pornography being a risk factor towards STI. Meanwhile, sufficient knowledge and a positive attitude are not positively correlated with STI's prevention behavior, because behavior actually is complex entity influenced by culture, environment, social interaction, and the media. Condom is not common among Eastern culture and is not usually agreeable to the values and norms in Indonesia. However, the association between knowledge, attitudes, and behavior of avoiding HIV patients shows that it is not related. It is favorable that people with HIV are not stigmatized with well-educated people and positive attitudes. They mostly will not avoid HIV patients for spreading STIs. Respondents think that avoiding patients with HIV is not a solution to avoid transmission of STIs. In conclusions, there is an association between the level of knowledge and attitudes related to STIs for women of reproductive age, and no correlation between knowledge and attitudes towards STI prevention behavior. So our recommendations are to improve the questionnaire for behavior assessment aspects and add larger samples to get more proper results. And that brings us to the end. I would like to thank you for your time and attention.